Hello everyone, I am Dr. Ziyad, MBBS, MD in Health Informatics. I am also specialized in clinical terminology and medical coding. In this tutorial series, I will walk through Model Paper 1 for the AAPC CPC Examination. I will share quick techniques to find answers very easily, along with the detailed explanation to help you to understand the key concepts. Chapter number 13, Radiology Codes. There are 6 questions. These questions will focus on both diagnostic and interventional radiology, including diagnostic ultrasound, radiologic guidance, mammography, bone and joint studies, radiation oncology, and nuclear medicine. Question number 1. A 45-year-old female patient with severe endometriosis received a CT scan of the pelvis and abdomen with and without contrast. What radiology code should be reported? So there are 474,000 codes are available. Please post a video, take your CPT code book and find the answer.
3, 2, 1.
Okay, here you have to highlight this is severe endometriosis, CT scan of the pelvis and abdomen with and without contrast. Okay, if you see the codes, the adjacent codes are used 74,176, 77 and 78 and other two codes available. So let's use the elimination method to find the answer. So directly go to the codes. When you directly go to the codes, you can see 74,176 is computer tomography, abdomen and pelvis without contrast material. But in our case, both with and without contrast material used. So the other code is 74,177, that is with contrast materials. So if you use 176 and 177, it may contain the without contrast and with contrast. But do not hurry. You have to check the other answer. That is 74,178. That is computer tomography, abdomen and pelvis continuation without contrast material in one or both body regions, followed by a contrast materials and further sections in one or both body regions. Here you can see 176 is without contrast material, 177 is with contrast material, but 178 is with and without contrast material. So in the case, we have used CT scan of pelvis and abdomen with and without contrast material. So both the procedure is included in the single code, that is 74,178. So instead of A, you have to select the answer B. This is very careful. Also, you have to note the additional note, that is report 74, 176, 177 or 178 only once per CT abdomen and pelvis examination. So here the with and without contrast, it is coded in a single code, that is 74,178. So the correct answer is B. If you encounter this case in a real working scenario, you have to go with the CPT alphabetic index. So in the CPT alphabetic index, you have to go to the CT scan, then go to the subcategory of abdomen, lead you to the following codes. Then you have to go back to the tabular list and have to confirm the answer. So once you confirm the answer, the correct answer will be B. Question number 2. For a 2-year-old presenting with right upper arm pain, where X-rays of the right humerus, anterior, posterior, and lateral views are obtained and show no fracture dislocation or other abnormality. The correct CPT and ICD-10 CM codes for the physician service are, so there are 473,000 codes are available with the ICD-10 codes. So please post the video, take your CPT and ICD-10 CM code books and find the answer.
3, 2, 1.
Okay, in this case, you have to highlight this is 2-year-old child presenting with the right upper arm pain. X-rays of the right humerus, anterior, posterior, and lateral views shows there's no fracture, no dislocation, or other abnormalities. So let's go to the CPT codes. So you can see the adjacent codes are used. So you can use the elimination method to find the answer. When you go to the CPT code, 73,050 is radiologic examination, acromial clavicular joints, bilateral. 73,060 is, that is the continuation code of the previous one, that is radiologic examination, humerus, minimum of two views. So here you have used anterior, posterior, and lateral views. So there are more than 2 views are used. So you can use this code 73,060. But you can see 73,092, that is also continuation code of the previous one, that is radiologic examination, upper extremity, infant, minimum of 2 views. So you have to be very careful with the age. The infant is less than 1 year, but here the child's age is 2 years. So this is not the infant. So you have to be careful. The infant is less than 1 year. Here the child is 2 years. So no need to use this code. So the correct code is 73,060. So you can see the answer. The A have the 73,060 and B also having the 73,060. But the additional modifier 26 is used because after taking the X-ray, the physician is interpret that there's no fracture, dislocation, or other abnormalities. In this case, the modifier 26 should be used because there's a professional component. Because the physician interpreted the X-ray that there's no dislocation. So for this professional component, you have to add the modifier 26. So you can eliminate the answer C and D. So let's check the ICD-10 CM codes. So when you go to the ICD-10 CM M79.62, that is pain in upper arm, and 621 is pain in right upper arm, because in this case there's no other diagnosis available. Only the diagnosis available here is the symptom. The patient having pain in upper arms, there's no fracture, dislocation, or abnormality. So in this case, without any diagnosis, you can use the symptom as the diagnosis. So in this case, you can use the code M79.621, that is pain in upper arm. If you see other code, that is R93.89, that is abnormal finding on diagnostic imaging of other specified body structure. But here there's no abnormalities available. So the correct answer will be A. So if you encounter this case in a real working scenario, you have to use the index of the CPT codebook and ICD-TM codebook. So if you go to the CPT alphabetic index, there you have to go to the X-ray, then go to the subcategory of humerus. It will lead you to the code 73,060. Again, go back to the tabular list and confirm the answer. And if you go to the ICD-10 CM alphabetic index, here the diagnosis will be pain. So go to the pain, then go to the subcategory of limb, again go to the subcategory of upper or upper arm, then you will find the codes M79.62. Again, go back to the tabular list and confirm the answer. So once you confirm the answer, the correct answer will be A. Question number 3. A cardiologist who reviews and interprets the results of an abdominal aortography performed with the serialography on a 53-year-old female patient with atherosclerosis. Which CPT code should be reported? So there are 475,000 series CPT codes are available. So please pause the video, take your CPT code book and find the answer.
3, 2, 1.
Okay, in this case, you have to highlight this is cardiologist who reviews and interprets abdominal aortography performed with the serialography patient with atherosclerosis. When you see the answer, all answers are adjacent answers 75,625, 625 with modifier, 605, and 630. So you can use the elimination method to find the answer. So directly go to the codes. When you directly go to the codes, the 75,625 is aortography, abdominal by serialography, radiological supervision, and interpretation. So this is exactly matching the scenario here. Aortography with the serialography, radiological supervision, and interpretation. So the correct code is 75,625. Here there's a professional component is involved. So do we need to add the professional code, that is the professional modifier 26 for the professional component? But here keep in mind the code itself says the professional part. For example, here you can see radiological supervision and interpretation. So the interpretation part is already included in the code. So there's no need for additional modifier. So you have to be very careful with answer A or answer B. Here, actually the professional component is involved, but that professional part is already included in the code. So the correct code will be A. If you see other answers, 605, that is aortography thoracic, but here it is abdominal aortography. 630 is aortography abdominal plus bilateral iliofemoral, but here only the abdominal part, that also including the professional component. So the correct answer will be A. So if you encounter this case in a real working scenario, you have to go with the CPT alphabetic index. When you go to the CPT alphabetic index, go to the index of aortography. There go to the subcategory of aorta imaging. It will lead you to the following code series, 75,600 to 630. Again, go back to the tabular list and you have to confirm the answer. So the correct answer will be A. Question number 4. A patient undergoes a CT scan of the abdomen and pelvis. The imaging study includes multiple axial images acquired after the administration of both oral and intravenous contrast material. What is the correct CPT code to report for this diagnostic imaging service? So there are 74,000 and 72,000 code series are available. So please pause the video, take your CPT code book and find the answer.
3, 2, 1.
Okay, here you have to highlight this is CT scan of the abdomen and pelvis with multiple axial images after the administration of both oral and intravenous contrast material. So when you see the answer, there are adjacent codes are used here. So you can use the elimination method to find the answer. So directly go to the codes. When you directly go to the code, the 74,150 is computed tomography abdomen without contrast material. 160 is with contrast material. But here abdomen. But in our case, the CT scan for abdomen and pelvis. So the 160 is not suitable here. But you see 170 without contrast material followed by contrast material and further sessions. So 170 also not suitable because here we are only using the contrast material. 174 is computer tomographic angiography abdomen and pelvis with contrast material, but here there's no angiography involved, only the CT of the abdomen and pelvis. So 74 also not suitable. 176 is computer tomography abdomen and pelvis without contrast material. 177 is with contrast material. So in our case is CT scan of abdomen and pelvis with the contrast material. So the correct answer will be 74,175. That is answer B. If you see other answers, 72,192, that is computer tomography pelvis without contrast material, and 197 is with contrast material. Here it only says the pelvis. So in this case, our case is abdomen and pelvis with contrast material. So the correct code will be 74,177. So the correct answer will be B. If you encounter this case in a real working scenario, you have to go with the CPT alphabetic index. When you go to the CPT alphabetic index, here this procedure is the CT scan. So go to the CT scan. There you have to go to the subcategory of with contrast. Again go to the subcategory of abdomen. There it will lead to following codes 74,160 and 74,077. So again go back to the tabular list and confirm the answer. Once you confirm the answer will be B. Okay, question number 5. Radiation oncology codes consist of a specialized portion of radiology codes that are used to report which of the following: A. Radiation services provided by the oncologist. B. Radiology services that are used to treat benign neoplasms. C. Radiological services that are used to deliver radiation treatment to tumors. D. Radiation services that are provided in hospitals. So, in addition to the codes, you may get following type of theoretical questions. So, please pause the video, think of an answer.
3, 2, 1.
So the radiation oncology is a medical specialty that uses radiations like X-rays, gamma rays or protons to treat the cancer and certain benign conditions. The CPT code specifically for radiation oncology, that is 77,000 series in CPT book, describe the planning, delivery and management of the radiation treatments. But the first answer, radiation services provided by oncologist. That's true, but not only by oncologists, but other technician or normal physician also giving radiologist treatment. So it is partially correct. And also the radiation treatment sometimes give to treat the benign neoplasm, but most of the time it is for the malignant neoplasm. But in the answer B is partially correct because it says it's used to treat the benign neoplasm, but in real working scenario it is given for the malignant neoplasm as well as benign neoplasm. So the answer B also partially correct. So the core purpose of the code is to report the delivery of radiation treatment to tumors. So the correct answer will be C. So which is the primary focus of the radiation oncology. Also the radiation services can be provided in various settings, not just hospitals. So the answer D also partially correct. So in this case, most so in this case, the most accurate and comprehensive description is answer C. That is radiological service that are used to deliver radiation treatment to tumors. The last question of the radiology series, that is question number 6. A physician orders a transvaginal ultrasound for a young woman presenting with right lower abdominal pain and a medical history of ovarian cysts. The primary objective of this diagnostic imaging is to evaluate for an ovarian cyst as the etiology of her pain. Which CPT code accurately represents this ultrasound service? So you can see there are 476,000 code series available. So please pause the video, take your CPT code book and find the answer.
3, 2, 1.
Okay, here you have to highlight this procedure is the transvaginal ultrasound on the right lower abdominal pain with the history of ovarian cyst. So this is a diagnostic imaging to evaluate the ovarian cyst. So when you see the answer, you can see all answers are adjacent codes, 76,800 and something. So you can use the elimination method to find the answer. So directly go to the codes. When you go to the code, the 76,801 is ultrasound pregnant uterus real time with image documentation. Here it is for the pregnancy. So that is not the case here. When you see other code, 76,830 ultrasound transvaginal. So that is the case here. Let's see other answers, whether they have the additional information. 76,856, that is ultrasonic pelvic, non-obstetric, real-time with image documentation. But this is not the case. Our case is the transvaginal, but this is pelvic. 76,857 is limited or follow-up, for example, follicles. So in our case, this scan is for the transvaginal ultrasound. So that is exactly matching the code 76,830. That is ultrasound transvaginal. So the correct code will be B. So if you encounter this case in a real working scenario, you have to go with the CPT alphabetic index. When you go to the CPT alphabetic index, this procedure is the ultrasound scanning. So first you have to go to the ultrasound. Again, you have to go to the subcategory of transvaginal examination. Then it will lead to the code 76,830. Again, go back to the tabular list and confirm the answer. Once you confirm the answer, the correct answer will be B. So if you are preparing for the AAPC CPC examination, my channel will help you to solve the problems you are facing in your examination preparation. So please subscribe my channel. And if you have any doubts or any questions, you can put in the comment section, or else you can email me, or you can WhatsApp me to the email and the WhatsApp number displayed here. So please subscribe my channel and stay with me. Thank you.